Hi, this is Jessica Etheridge, and this PowerPoint is on spina bifida. Spina bifida is a neural tube disorder, which means the spinal cord is not fully enclosed. The nerves and the muscles in the spinal cord do not develop normally. There are three types, which are occulta, meningocele, and myelomeningocele. The picture here is of the most common form, when we think of spina bifida, what we consider, and that's the myelomeningocele. The first form of spina bifida is the occulta. This is the least severe form, and it's not usually visible externally. As you can see from the picture, the vertebrae in the lower back are only slightly misshapen. There is no bulge, there is no sac here. Only an estimated 10% of the population has this form of spina bifida. The second form of spina bifida is the meningocele. This is where the meninges of the spinal cord form a fluid-filled sac and it protrudes from the back. But in this sac there are no nerves and there are no meninges. Therefore the nerves aren't affected and the person functions normal. As you can see in the picture, it's just fluid-filled, there's no nerves in there, and the child or the person is normally develops fine and has no problems. They may need a surgery to prevent future nerve damage, but it doesn't cause the paralysis. The third form of spina bifida is the myelomeningocele. This affects 6 in 10,000 live births. It is the most common form of spina bifida, and it is what we think of when we think of spina bifida. This is where the spinal lining, the spinal cord, and the nerve roots are all contained in a sac that protrudes from the back. That also makes it the most severe form. And you see in the picture, the nerves and everything are in that sac, and that causes paralysis because the nerves haven't developed normally. The doctor can put the sac back into the back at birth through surgery, but they're still at a higher risk for infection and the paralysis. Some causes of spina bifida can either be genetic or environmental. One of the major ones is a mother with a folic acid deficiency. These neural tube disorders form within the first few weeks of life, and the neural tube is completely formed by day 28. If the mother is not getting enough folic acid before she conceives, this child stands a much higher chance of neural tube disorders. This can be prevented by the mother taking a vitamin before even trying to conceive. Another cause is the mother has diabetes or obesity. They can put the baby at a higher risk for developing these neural tube disorders. Some characteristics of spina bifida. One of the major ones is muscle weakness. This can be in the feet, the ankles, and or the legs. And as I mentioned before, there can also be paralysis below the area of the spine where there is incomplete closure. That usually happens with the myelomeningocele, and a lot of patients may be able to walk, but they spend most of their time in a wheelchair because it's so bad. They can also have a loss of sensation below the area where it occurs. They can also have a loss of bowel and bladder control. This can be a big deal for educators because students may not always be able to control this, so you have to be mindful of their needs in this area. There's also a hydrocephalus, which is fluid buildup on the brain, and that can be controlled by a shunt, but teachers need to be aware if their students have these, because if it becomes infected or it's moving, it can change the child's personality, they can become irritable, and it has a lot of other effects that you need to be aware of. They also have growth deficiency, difficulty with learning, paying attention, expressing or understanding language, grasping, reading, and math. Those are going to be your learning disabilities. They may fall slightly behind in these areas because of their difficulties. They also have difficulties in locomotor and mobility movements. This is where you need to make your classroom accessible to all students because they may not be able to move as well as the others. They also have a difficulty with the fitness level because a lot of them are wheelchair bound. They don't exercise as much, and that can cause a higher rate of obesity. There are also motor difficulties in arms and hands, and that can cause slowness in performing certain tasks, such as writing, typing on a computer, things of that nature. There's also possible seizures and latex allergies. Some educational implications of spina bifida. Children usually have paralysis, and they can be in wheelchairs, so you need to make sure that your room and all activities are wheelchair accessible, that the aisles in your room are clear, that students are able to move around easily. Most of these students have average IQs, some are above and some are below. It depends on the severity of the injury of the spina bifida, and the higher the lesion is, the more severe their learning disability, and that's something to always keep in mind. They also have the poor hand-eye coordination, and they can have trouble with writing, typing, some fine motor skills because of that. They also may have trouble verbalizing their wants and needs because they do not have the language acquisition skills that other students of ability may have. Some educational strategies to overcome these implications would be special desks that you can use so that they always have access to a workspace. They can be given verbal tests so that their problems with hand-eye coordination can be overcome. Since they cannot write as easily, it's easier for them to do a verbal test. They still understand the information, they just don't have to write it. Picture cards can be used to help the student show what they need if they're unable to verbalize it. They could also work with a speech teacher or a pathologist to help them develop their language. And of course, a special education teacher can always be used to help the students with areas such as math that they may be lacking in. Some agencies that offer assistance with spina bifida would be the Spina Bifida Association National Resource Center. You can access this online. You can find fact sheets, more information, questions to ask a doctor, things of that nature, anything you could really need about this disorder. There's also a Spina Bifida Association of Alabama that helps with the students in this state to accommodate them and help with any questions you may have.